Yeah.
Okay. Yeah. So I think we're recording now.
Yeah.
So, hi, Stu. Thanks ever so much for just taking the time, really, so we can have this video chat and to share your story. So can you just tell us briefly about you and what you've sort of been through this past year and a half?
Yes, I can. It's been a long and difficult year, to be honest. Started off at the beginning of last year, 2023 or whatever it was, watching the TV, and it was the anniversary of Bill Turnbull's death, breakfast TV presenter who died of prostate cancer. And he had run a bit of a campaign in his final months about people getting checked early because it's so treatable, etc. My dad had died of cancer back in 1990 something, and he'd started off with prostate cancer, which he'd left too late. And as it happened on that day, I was going for blood tests to see whether or not I should be taking steroids. No, it's not steroids. What do you call them?
Statins, is it?
Statins, thank you, yeah. So I asked the nurse who was taking the blood, I said, is it possible to do the prostate cancer check at the same time? She said, yeah, of course it is. Because I thought, well, we'll just tick it off the list, it'll be fine. I had no symptoms, I was completely asymptomatic. Anyway, of course, it came back positive, which is a bit of a surprise, but not a massive shock, because obviously the family history and I'm the right age and all the rest of it. And I was aware that you can be asymptomatic. But that's when the fun started, because for the first time in my life, somebody stuck a finger up my bum and so on, and off we went. And yes, the diagnosis was made. The decision was made that I would have some radiotherapy treatment from about September, I think it originally was. So this must have been about March or April. They were in no hurry. I wasn't particularly advanced. No problem. And then in May, my knee gave way suddenly on the tarmac in Greece as we stepped off an aeroplane. And I ended up spending the first night of our holiday there in hospital. While Sarah went and spent her first night in the hotel. Till eventually I joined her at 2:00 when the taxi driver finally got me to the hotel. Long story short, it turned out cruciate ligament had gone, but it was basically the only thing holding the knee together. Osteoarthritis had taken its toll, and I needed a new knee. And then over the next couple of months, it became very apparent that the knee was more urgent than the cancer. I couldn't walk. I was using a stick. I was in a lot of pain. The cancer was completely in the background. So the decision was made to swap the treatments. It was going to be cancer treatment September, knee January, basically. So they swapped them. Did the knee in November, as it happens. November the 13th, I had a knee replacement. And then 6 weeks after that was the day after Boxing Day. That was my 6-week review following the knee surgery. And then 2 weeks after that, I started the radiotherapy, which took us into February, was it?
February, yeah.
Or March, might have been, can't remember.
Yeah.
Yeah,
wow.
So I suppose the worst bit of it has turned out to be that there wasn't a long enough gap between the knee being able to recover and going into the radiotherapy, which is probably my fault, but there we go.
Of course. I mean, it wasn't your fault. I think it's just one of those things which timings just didn't quite line up, but we didn't expect to be having, as soon as we landed at Greece for a nice holiday, an ACL rupture. Which has resulted in new knee. So hopefully you managed to get the best out of that holiday still. I'm sure it wasn't quite what you and Sarah had in mind.
Well, it was different. I was hobbling around with a stick for most of it. the funniest bit was the taxi driver picked me up from the airport, and I had to have some painkillers, so I had to go to the pharmacy. So the taxi driver pulled up outside the pharmacy, went in to sort it all out with my credit card in his hand, and the pharmacist wouldn't do it. He said, "No, the customer's got to come into the pharmacy." Well, I couldn't stand, I couldn't walk, so I hobbled into the pharmacy, just through the door. Only just made it through the door and waved at him and said, "Is this enough?"
Goodness me. I mean, yeah, you do like to hope that you're safe, especially when you're spending money in other countries. But wow, not what you need, is it? No.
No. It's a lot.
Yeah. So when you found out that you had the cancer diagnosis, and then you recognized, or the consultants recognized, that they had to prioritize the knee, how did that make you feel?
Relieved, to be honest. As I said, the cancer wasn't causing a problem. They were quite happy for it to wait. The knee was becoming increasingly problematic. I could barely do anything without a stick. I couldn't walk very far at all. So yeah, I was relieved that they, between them, were happy to make the change.
Yeah. And how did you feel about the wait from when you first did your knee, recognizing that you needed the replacement, until the November? What did it hinder you from doing? How was work? How was your archery, your walking activities? How much did it impact you? Yeah.
It did impact me. I mean, archery, I reached a point where people were actually going to collect my arrows for me, because 20 yards was too far to walk, and 20 yards back too far. I think I was I still driving? Yeah, I was still driving, because the pain was in the weight bearing, and of course the weight of the clutch was nothing compared to the weight of walking. So actually driving was easier than walking. But I mean, in terms of a weight, it's nothing, is it really? From May till November, I was so lucky. You know, people wait 2 years.
Yeah.
Surgery. Yeah. So I have no complaints.
And that's the thing, isn't it? It's not the same for everybody. I mean, obviously you had a timeline, and it is done in order of priority of who does need that knee replacement. So I suppose that you was lucky that you didn't have to wait as long, and therefore have to suffer as much muscle wastage. But it does have a massive impact, doesn't it, for that amount of time where you can't do your archery, so you're not necessarily getting your social side in as much. So how did it feel after your knee replacement? Was you like, yes, I can go and do things again? Or did you recognize it might be a bit of a journey back to where you came from?
Oh, I knew it was going to be a journey, because, as I said, there was only basically a week or two between the 6 week point, at which point you're only just healing, really, as you know, before what started the radiotherapy. And the radiotherapy, one of the side effects of that was that I couldn't really use the exercise bike for any length of time. So yeah, there was muscle. I think what people sort of forget or don't realize is when you see these professional footballers break a bone in their foot, and then, you know, a few weeks later they're back up playing again. But that's because they've gone straight from the pitch where they broke the bone straight to hospital, straight to being fixed. Us normal people go for quite a few weeks deteriorating after the injury, before we can actually have anything done. So it's not that I've done nothing since May. I hadn't been able to do an awful lot for weeks before that. So once the knee's fixed, you've got a year's worth of, as you say, muscle wastage, lack of fitness, lack of stamina. All that is still gone. You can see the exercise bike behind me.
Yeah.
I do get on it. I can do 10 minutes.
Great. Great.
That's it.
How did that feel though, being able to get back on it? Because some people are probably not as diligent with their exercises as what you are, and therefore don't necessarily get the bend the same way in the knee. And I know that was a bit of a challenging or a sticking point for you. So how did you think about overcoming that, and how do you feel now that you can do 10 minutes based when you've did your first revolution?
That first revolution, well, you will remember, I put it off, partly because I'd had a partial knee replacement on my right knee sort of 6 years ago. And I remember, I couldn't forget how much it hurt, the first revolution. And I think I was just afraid of the pain, if I'm honest. And I probably waited longer than I should have done. Because when I eventually did do the first revolution, it was a bit stiff, a little bit of a niggle, but it was all right. And I was surprised at myself. I thought, well, why have I not got on with this? Told myself off a bit. So I've got the seat set as high as it'll go. So my leg is pretty straight, to be fair. And then I'll do 5 minutes of that. And then I'll drop the seat a bit so that my leg's a little bit more bent. And that really slows me down. I'm doing like 12 revolutions a minute or something. But it's getting there. It's improving every time I use it,
which is great. So do you feel that it's better to do things for your knee like in the morning, midday and in the evening, so little and often, or do you prefer or feel the benefits more when you do a larger session, just once a day or once every couple of days?
No, I don't do large sessions. I try and do some exercises, stretching and things, and then on the bike. So a total of, say, 15, 20 minutes in the morning. And then at some point in the evening, I'll try and get back on the bike again and do another 5 or 10 minutes. So, yeah, little and often. Mm-hmm. Yeah, I know we had a conversation where I said to you, I feel as though I've overdone it. And your response was, you can't overdo it. All movement is good movement.
Motion is lotion.
Yeah. So I've tried to remember that. And so whenever I'm walking upstairs at the end of the day thinking, God, this really hurts again. But that's fine. I haven't overdone it.
Excellent. Good, Stu, good. So mixed obviously with getting back onto your bike and starting to increase your fitness. Obviously, You've had the battle of the radiotherapy as well. How much did the radiotherapy take it out of you? Was there any shocks with that? Was you well aware of how you may feel going into that?
I was aware, because they give you thick booklets full of information, and which is easy to read.
Good.
It doesn't really prepare you. In terms of how it affected me, the actual radiotherapy effect, maybe I should backtrack a bit and say the biggest impact of it to start with is the embarrassment factor. There's no getting away from what prostate cancer is and what it impacts. It is bladder and bowels and penis. That's it. That's the crux of it. Because I was asymptomatic, I wasn't having any problems. As soon as I started having the radiotherapy, I started with the classic frequency, urgency, feeling as though I hadn't finished having a wee, and that kind of thing. I asked the radiotherapist, why am I suddenly doing this? And her response was, well, the prostate, when it's enlarged because of cancer, that's the impact of it being enlarged. We give it radiotherapy and it enlarges as a consequence. So obviously it thinks it's got cancer and it gives you exactly the same symptoms as you would have had. So I'm now working my way through those symptoms. But the actual, the treatment itself, that sums up the treatment. But the point of getting from initial diagnosis to starting the treatment is a journey of embarrassment, basically. You go through experiences that you don't think about, you don't want to think about.
No, and I think that it's nice that you've been so open and honest about it, because there's probably some listeners, or will be some listeners who may have prostate cancer or know somebody with prostate cancer who don't actually recognise what they're going through because of that fear of embarrassment, and they don't want to talk about it maybe as much as a different cancer. And I think it's so important that we do talk about it and just try and reduce that embarrassment factor.
Okay, I'm quite happy to talk about it. The embarrassment is around, well, initially, as I said, the digital examination up the rectum, which was not something I'd ever had before. And within a week, I think 3 different doctors had stuck their fingers up my bum. So it's like they didn't believe each other. And then a decision was made that I needed a biopsy. And there's basically 2 ways. There's 2 routes to the prostate to take a biopsy. One is up the bum, and the other is perineum. What was the word they used? Something like intraperineal or something.
Okay.
Which, for those who don't know, is the area between the scrotum and the anus. Very small portion of skin, and basically you're naked from the waist down in what amounts to the birthing stirrups. Very much the position that I guess women must be in when they have what do they call it? An examination for
smear.
The smear test. Thank you.
Yeah, it's okay. Thank you.
Yeah, so there you are, legs wide apart, naked, with this woman sticking this thing 26 times up. Yeah, taking snips each time. I have to say, I tend to find humour in these situations. The most embarrassing thing I thought, and the funniest thing I thought, was that they tell you they're going to tape your testicles out of the way, which they did, but they used a very small piece of tape, and I thought, no, surely we need more tape than this. Apparently not. And yeah, so they did that, and then afterwards, it's the traditional thing of you go and have a cup of tea and a biscuit in a little waiting room, and you watch the next fella walk in, and he doesn't know what's coming to him, and you think, I wonder how big a piece of tape he's going to need.
I think it's great that you can see humour in these situations. Hopefully it wasn't too painful when they took it off either.
So yeah, so that was that. Then what did they do? Oh, then in order to direct the radiotherapy beams, they put 3 gold pellets into the prostate. Well, there is only one way apparently to do that, and that is up the bum. So 3 gold pellets worth apparently about 250 quid at the time. So you come out a bit more valuable than you go in.
You do.
Apparently they melt though. When you get cremated, they melt. So you don't necessarily. The person who's getting the remains doesn't necessarily benefit too much. Gold has a very low melting point. So they do that, and then when it comes to the actual treatment, that you go into a machine called it's not a CT scanner. Well, what's it called? It's just gone out of my head. But anyway, you lay on the thing, and unlike an MRI scanner, in which you go into it and it's circular and it makes lots of noise and stuff, this thing actually moves around you, in and out. Bits of it move, bits of it don't. But again, they're using the gold implants to direct the radiotherapy. So again, you're naked, and again they decide to cover you, but they cover you with the smallest piece of paper. And again, I was like, no, A4, surely. But no, not A4. you realise you've been overestimating yourself your entire life. And it's different people each time, different radiotherapists each time, mostly female. Sometimes the blokes are having a laugh at you for a change. 20 days later, that's all done. And halfway through, you forget about it anyway. You don't care. You just want the treatment to work, which it does, apparently. You don't find out whether or not it's worked until a few weeks afterwards. I've not actually had the all clear yet, because they can't tell from the machine. They have to do blood tests, which take a little while. So
do you know when you're having your blood tests, Jim?
No, but it can't be long now, because it must be 3 weeks, I think, since I finished.
Mm-hmm. So tell me about that finishing day. What did you do? How did you feel? Who was with you?
Well, I'd already decided. I'd already started posting on the Trust's Facebook page, telling the story, not because I wanted the glory and the likes, but it was, I took the view that the only reason I was there was because of Bill Turnbull telling his story. And I thought, well, all right, he's got a bigger audience than me and all the rest of it. But if I tell a few people and one person goes and gets checked, then job done. So that's what I did. And of course, it got picked up by the comms team and the patient journey people. And long story short, on the final day when I had the opportunity to ring the bell, which not everybody does, I said, well, for the same reason, let's do it. Let's ring the bell and tell people why I'm doing it, which is what I did. So a couple of members of my team went down, I think just to have a laugh. And a couple of friends went down, including Becky. And the comms photographer video lady went down, and I had a 2-minute speech thing that I came out with, and it got plastered all over Facebook, and a lot of people thought it was a good thing to do, which made it worthwhile.
I think it was a brilliant thing to do, and that's the reason why I asked you really to come on here and share your story, Stu, because you are incredible and you don't give yourself enough credit at all for the influence that you have over people, and the bright shining smile we've seen through all of this. So yeah, thank you so much for that. So what would you say, reflecting on your experience of the prostate cancer, what advice would you give someone who might be going through a similar situation right now?
Get tested. Don't delay. If you've got it in the family, and you're in the right age bracket, or even if you're too young for the age bracket, get tested anyway. Is my advice. Yes, you will have embarrassing moments, but the choice is be embarrassed or be dead. Which would you rather have? If getting tested early means I get a few more years, then get on with it.
Amazing. Amazing. Thanks, Stu, ever so much for taking the time, like I said, to do this video. I'll end the recording here, and then we'll just have a little chat off screen afterwards. All right. Thank you.
Yeah. Okay. Thank you.